Hello, my name is Tari Papavanovas. I'm a specialist physician currently doing my training in infectious diseases at Groote Schuur Hospital, University of Cape Town. In this segment, I will illustrate how to prepare your trolley, how to don the equipment, how to do the procedure of swabbing the patient, the doffing of equipment, the cleaning of your equipment, the paperwork, and then also frequently asked questions. How to prepare your trolley for seeing a patient that may have COVID-19. So as you can see, you have your hand hygiene, which will be this bottle over here. Importantly, this is what you use for your hands because it contains an emollient. So it also protects your hands when you put so much alcohol on that it doesn't dry out or crack. So that is this one. This one contains 70% alcohol, which is for cleaning material. So this is what you'll use to clean your stethoscope, your visor, your goggles, whatever you need. It's this one. Please don't clean your equipment with this. The reason being is the emollient from this material actually causes your equipment to be sticky and actually makes it rather uncomfortable to work with. Then you can use your apron, and then you can prepare your masks. Either your N95 if you're going to do an aerosolization procedure, or your normal surgical face mask. And then have your gloves ready, and then also your goggles or your visor, depending on which one you want. And then once again, you also need your swabbing material over there. And then I also like to have a paper towel with me, and that's for cleaning, the cleaning process at the end. I will now go on to the donning process. We've come up with an acronym that helps one to remember. It goes HAM, GG, and Candice and Alucci have kindly made this poster for us, which will help people to visually be able to see the acronym as well as to try and follow it. So HAM, GG, hand hygiene, apron, mask, goggles or visor, and then your gloves. I will now demonstrate how to do hand hygiene. So put 2 to 3 mils on your hands, and then you can start with your fingertips, rubbing them on your palm of your hands, both sides, doing the interdigital web spaces, both sides. I like to interlock my fingers and then rub them together, do your hands, and then also rub onto your thumb. And I like to go all the way up to my elbows. This usually takes around 20 seconds to allow it to evaporate. It's important that you lather in the alcohol, and this allows the alcohol to work to kill any pathogens that might be on your hands. So that is hand hygiene. The next part is the apron. So when putting on the apron, it's important that you tie it in a bow at the back, because this will allow you later on to remove it more easily than if it is very tight. So hand hygiene, apron, then mask. So because I'm going to teach you how to swab a patient, I'm going to be wearing an N95 for this procedure. So here's your N95. What you need to do is release the blue elastic straps from each other, white side at the bottom and pink at the top. Place it over your face, one strap below your ear, one strap above your ear, and importantly, you need to mold your mask onto your face. Don't pinch it, mold it, and to test that it is fitting adequately on your face, what you can do is you can take a deep breath in, and as you can see, my mask collapsed, and then you can breathe out. And once again, you can see it expand. If you notice that your glasses, if you are wearing spectacles, start to mist, then I recommend trying to mold your mask again to find the leak. Okay, so hand hygiene, apron, mask. Now you can put on your goggles or your visor. In this case, I'm going to put on my visor. And now you can put on your gloves. A single glove is more than adequate. And now you are ready to see your patient in either the testing center or in your ward. What I do recommend is taking a trolley into the room with you, which has all your equipment on. So that will include your stethoscope and your swabbing material. As you can see, I'm not wearing a stethoscope, and importantly, I'm also bare below the elbows. You don't want to contaminate any other equipment that might be on you. So the equipment that you'll need, you can use one of these swabs over here, preferably a swab that is made of nylon or polyester, and one that has not got a wooden shaft. If you have a cotton or wooden shaft, it can sometimes inhibit the virus. So not ideal, but you need to use what you have in your testing unit. Importantly, I'd like to show you, this is the swab that we use in our theaters, which has some bacterial media at the bottom. Please do not put this swab inside the bacterial media. Reason being is you're just going to put the virus in the media, and then you won't be able to actually pick up the virus. So unfortunately, the lab will probably reject that sample because it probably won't be adequate for them. What else do you need? You can also get your viral transport media, which is this one over here. If you do not have stock of the viral transport media, your next option is to take one of the CSF tubes that we use, and you can put in sterilely 1 to 2 mils of normal saline. The reason why we say this is the viral transport media or the normal saline actually helps the virologist to extract the virus. If you do not have either of these, your other option is to send the swab back in its container that it came with. As you can see, this swab over here does not contain any media at the bottom, so it should be safe to send that off. I will now demonstrate how to do the procedure of swabbing the patient. It is important that you explain to the patient what you are going to be doing to them, and that it can be a little bit uncomfortable. It is important that you position the patient in the correct manner. So I recommend that you ask the patient to sit down and extend their neck a little bit backwards. With regards to doing the procedure, you need to basically take a nasopharyngeal swab, and you need to decide on the distance to go in. So to measure the distance, one would need to measure essentially from the nostrils to the tragus of the ear. In some people, you may only go this deep, whereas in other people, you may go quite deep in. And that obviously depends on the structure of the patient. So with regards to doing the swab, I will demonstrate it on both models. Essentially, you take the swab, go through the nostril, onto the superior aspect of the hard palate, all the way to the nasopharyngeal area over there. Once you are finished, you come out, and with the same swab, you go into the opposite nostril. So I will now demonstrate how to do it on the mannequin. So essentially, you go in and all the way to the back, and then rotate it 2-3 times, 2 or 3 seconds, come out, and then go in on the opposite nostril 2-3 times. It's important not to go in this direction. You do not want to go towards the patient's brain. You actually want to go at a perpendicular angle to the patient's face, or parallel, as we would say, to the hard palate. We may be changing the way we're doing things, so please watch this space. We may be saying that even a mid-turbinate swab is sufficient, which would mean you would only need to go about this deep, so it may be more comfortable for the patient. I recommend for now doing the nasopharyngeal, which is what I showed in the first place, and then watching what the NICD advises us with regards to doing mid-turbinate or other. So now I will demonstrate to you that if you are unable to do a nasopharyngeal swab, for example, the patient might have had recent surgery or recent trauma to the nasal region, or has a medical condition that precludes you from doing a swab in the area. For example, a patient might have a nasopharyngeal mass, which would make doing the swab rather difficult. In that case, you can do an oropharyngeal swab. When doing an oropharyngeal swab, there are 3 areas you need to test. So essentially, you need to test the tonsillar region on the right in a figure of 8 and on the left in a figure of 8. You may need a tongue depressor for doing right at the back of the oropharynx. So essentially pushing the tongue down and then taking a swab, going past the uvula and essentially doing a figure of 8 at the oropharyngeal area. Once you are done with that, you now need to place the swab within the media. So, when placing it inside, obviously one can see this is not going to fit. So what I recommend, without touching the tip of the swab, is to bend the plastic back and forth until it breaks. Discard the one side and open your media and put it inside. So this is now when you'll need your buddy, and in this case it will be Sister Isaacs who will assist me in taking the sample to the lab. So essentially, to prevent any infection risk, what one can do is, because this is potentially contaminated, I will now drop it in the sample within the bag of the NHLS bag, and then Sister Isaacs will be able to now take it to the lab. And for example, if for some reason that may have been contaminated, one can use your surface disinfectant to clean the outside. Okay, I will now go through the doffing procedure. So that basically means when you finished examining, taking a history, or taking bloods, or doing your swabs on the patient, is now when you can basically take off your personal protective equipment, your PPE. So you can remember it as get a good mask. The other option is to remember it as gag me. Okay, so let's start with the G. The G is your gloves. Why? Because that is potentially the most contaminated part of your body. So when taking off your gloves, it is important that you take it off methodically. You don't want to snap your gloves, because if you snap it, there's a potential spray. And importantly, you must slip your index finger underneath the glove, because this is the clean surface and that is the potentially contaminated. Slip it underneath and slowly remove your gloves. Once you have discarded it in the bin, it is important that you go on to hand hygiene. Hand hygiene must be done in between every single step of the doffing process. And as you can see, I go all the way down to my elbows, because when I'm in the room, there is a potential that I might have touched my apron, which could be contaminated. So when I'm in the room of talking on the patients, I generally stand around like this so that my elbows don't touch there. But don't worry, if your elbows or your forearms touch your blue apron, it's not a problem. You're just going to go and do your hand hygiene. Okay, so that was removing the gloves. We are now going to remove our apron. As you can see, it's rather difficult to remove an apron with this big visor on you. So now there's a slight subtle change. In that case, we are now going to remove the visor itself. So please don't touch it from the front, because that could be the potentially contaminated area. So what we recommend is taking it off from the back, away from you, and putting it at the bottom of your trolley. The top of your trolley is the clean area, and the bottom is your dirty area, just to help you remember. Okay, but I'm now going to demonstrate what would have happened if you were wearing goggles. So in that case, we did our gloves first. We're now going to take off our apron. So when taking off your apron, it is important that you undo the bow at the back, take a step back and put your hands behind the apron where it is clean and stretch the apron and move it over your head and then fold it up and then discard of it in the red bin. Once again, you need to go through hand hygiene. I'm not going to go through the whole process that we did in the beginning, but it needs to be at least 20 seconds long to allow the alcohol to evaporate. So, when removing your goggles, as we said for the visor, do not touch the front. Remove it from the back, take it off your face, and once again put it at the bottom of the trolley, and then do your hand hygiene once again. So this is all done in the room of the patient. And the reason why we do it in the room of the patient is there's a potential of contaminating the area around you. So when you took off your gown or you took off your gloves, you might have potentially contaminated the wall. So that's why in the room of the patient, we are assuming it is a contaminated area. So it's okay that you are now in that area removing off your equipment. You don't want to do it in the clean area because there's a potential that you contaminate an area and then yourself or one of your colleagues will now come and touch that area and rub their eyes or anything to that extent. And therefore, that's obviously not great infection control. So now you're ready to leave the room of the patient, okay, with your N95 on. So essentially, you're now taking out your trolley and you're going to close the door. If you are going to be in one of the COVID wards or one of the PUI wards, person under investigation wards, then I recommend just leaving your N95 for the duration of your shift. If you now, for example, need to go to the bathroom or you need to get something to eat and you've only worn your N95 for an hour, then what you can do is, as we've explained before, taking off your N95 and putting your N95 into a paper towel and covering the paper towel. And now you can put your paper towel with your N95 into a brown paper bag and you can use it again. It's important, once again, to perform good hand hygiene. Every time you take out your mask or put it back in, I recommend doing hand hygiene. I will now demonstrate how to clean your equipment once you have left the room of the patient that you may be treating. So, it is important to put a pair of gloves on. And as I explained earlier, this is your clean area and this is your potentially contaminated area. So it's important that you wear a pair of gloves. So now when cleaning your goggles or your visor or your stethoscope, all you need to do is spray the area with this surface disinfectant. I also spray the material area, and then you take one of your paper towels and you essentially clean it and rub it down until it is dry. And then what we do is we put it on top of the trolley to illustrate for the next healthcare worker that's going to do the procedure that it is clean. If it's at the bottom, you know it is probably a potentially contaminated area. And then you can do it for the rest of your equipment as well. A common question I get asked is, what do I wear when I come to work? So essentially I come in my normal clothing, and then when I'm in either the PUI, person under investigation unit, or in the COVID-19 area, I will then change into surgical scrubs. I will then work in those scrubs for the duration of my shift. But for example, if I need to get something to eat or I need to leave the unit, then I will change out of those scrubs into either new clean scrubs or into my normal clothes and carry on. The reason why we do that is you do not want to have the potential of walking around the hospital with potentially contaminated clothing, because you never know, you might rub against something, and then there's obviously an infection risk. Before I leave the hospital to go home, it's important that you clean all potentially contaminated areas. So for example, I clean my cell phone, my pen, my stethoscope, and for that, I use the surface disinfectant. A common question I get asked is, well, what do you do about your shoes? Some people have said, well, why don't you wear the blue overshoes on your shoes? The concern with that is that when removing those, that you might inadvertently touch something else and not know about it, and therefore potentially contaminate that area. So we're not really recommending that you should wear the blue overalls. What I have been doing is I literally just spray the top of my shoes, and then I will once again just wipe them down with a paper towel, and then obviously discard of that. When I get home, I basically open the door, take off all my clothes, goes in the washing machine, and then I go and have a shower immediately after that. And then I carry on with my usual activities. I've noticed quite a few of my colleagues will come to work in their normal clothes, and then will get changed in their own scrubs and have their dirty shoes, if you want to call it that, either left in their car or left at work. And then essentially get into their clean pair of scrubs, their dirty shoes, do their shift, and then go home. But before going home, they will then change into their clean clothes and leave their potentially contaminated shoes at work. When filling in the paperwork for these patients, it's important that you have your laboratory form, and on this form you can write SARS-CoV-2 or even COVID-19 PCR, and the lab will do it for you, including the contact tracing list. In saying that, the NICD has come with another way of doing it online, where you can just click and do it even on your iPad or on your cell phone, and that obviously is great in the sense of there's less paperwork and obviously less area for contamination because there's less touching of paperwork. So in summary, we have been through the procedure of preparing your trolley, the donning, the procedure of swabbing the patient, the doffing, the cleaning of your equipment, the filling of the paperwork, and then also the frequently asked questions. Thank you and stay safe.